Welcome to Easy Medicine channel. Today I start the topic that are the laxatives. So today I discuss what is the laxatives and their classifications and also the mechanism of actions of each the classified groups and their uses and also the adverse effect. So let's start the topic. So what is the laxatives? Laxatives are the drug that facilitate the evacuations of from stool from the bowel. So the laxatives are that drugs which help for the evacuations of the from stool or easily evacuations of the from stool. Mainly these laxative drugs are a drug which is used to treat the constipation, because in constipation the patient cannot pass stool easily. And I already tell these laxatives are the drug which facilitate or help evacuations of the from stool. So what is the constipation? Constipation is an infrequent bowel movement, usually less than 3 per week, and the stool are harder in consistency. So in constipation we can use laxatives for easily evacuation of stool and patient get relief. Now I discuss the classifications of laxatives according to their mechanism of action. According to their mechanism of action, laxatives are 4 types. 1. Bulk laxatives. 2. Irritant laxatives. 3. Osmotic laxatives. 4. That are the stool softeners. So there are 4 types of laxatives according to their mechanism of action, that are the bulk laxatives, irritant laxatives, osmotic laxatives and stool softener. Now I discuss one by one. Now I discuss what are the bulk laxatives. What are the drug under the bulk laxatives and the mechanism of actions of the bulk laxatives and their uses and side effect also. So let's start. The drug of bulk laxative, that are the burn, methyl cellulose and isopgol. Now I tell how the bulk laxative act in our body. These bulk laxatives are indigestible. So this bulk laxative we take by the mouth like isopgols. So when we take the isopgols laxatives by the mouth, it come into the stomach, but it is indigestible hydrophilic colloids. See this picture. Take the bulk laxative like the isopgol by the mouth and it's coming into the stomach, but it is indigestible, so in the stomach it is not digested. So by the stomach it coming into the intestine. So when it's come into the intestine, as these bulk laxatives are indigestible hydrophilic colloids, in the intestine it absorb water and soil up. So these bulk laxatives are absorb water and it soil up. So when these bulk laxatives absorb the water and soil up, GI wall distension also occur. And when the GI wall distension is occur, stimulations of peristalsis is also occur, and that's promote the defecations of the stool. So see in this picture, we take the bulk laxative like the isopgol by mouth, but it is the indigestible form, and when it's coming to the stomach it cannot be digested, so it easily come into the intestine, and intestine it absorb water and soil up. So when these bulk laxatives like the isopgols are soil up, it can distend the GI wall, and when the GI wall is distended, it stimulated the peristaltic movement, and when this peristaltic movement is stimulated, it promote the defecations of stool. These are the mechanism of actions of the bulk laxatives. So where these bulk laxatives are used, that are the irritable bowel syndromes and diverticulosis. So what are the side effects of bulk laxative? The bulk laxatives can cause bloating and flatulence, and these bulk laxatives are also alter the drug absorption, that are the warfarin. So these bulk laxatives, when these bulk laxatives are given with the warfarin drugs are not easily absorbed. So these are all over about the bulk laxatives. Now I again quickly recap about these bulk laxatives. So the bulk laxatives drugs are born, most important, isabgol and methyl cellulose. Methyl cellulose. So what are the mechanism of actions of the bulk laxatives? When we take bulk laxatives orally, it come in the stomach, but it is indigestible, hydrophilic colloids, so it can't digest it in stomach. For that, it easily come in intestine, and in intestine it absorb water and soil up. For that, GI wall distension occur, and for that increase peristaltic movement, and it can help for easily evacuation of stool, and it used in irritable bowel syndrome and in diverticulosis. And most important, it can't give with warfarin because it decreases the warfarin absorption rate, and its adverse effects are bloating and flatulence. Now I discuss about the stimulant laxative. These stimulant laxatives have the direct action on enteric neurons and GI mucosa. So the name of the drug under these stimulant laxatives are the senna, bisocodyl, ali and the custard oil, etc. Now I discuss how these stimulant laxatives work in our body. That's mean the mechanism of actions of the stimulant laxatives. So start the discussion about the mechanisms of the stimulant laxatives. When we take these stimulant laxatives like the bisocodyl, senna by oral, as the stimulant laxatives are non-digestible, it are not digested in the stomach. So when it come into the colon, it directly act on the GI mucosa. So this GI stimulant or GI laxative can bind with the colon mucosal layer. So these are the colon mucosal layer and these are the stimulant laxative, and in the colon these stimulant laxatives are bind with the colon mucosal layer. So when these stimulant laxatives bind with the colonic mucosal layer, it can causes irritation in colon mucosal layer, and when the irritation can occur in the colon mucosal layer, it can causes mild inflammation. And when the inflammation is occur in colon mucosal layer, it increase the prostaglandin and cyclic adenosine monophosphate level, and it inhibit the Na plus K plus ATPase activity in the intestinal mucosa, and it can increase the secretions of water and electrolytes by the mucosa. And when the secretions of electrolyte and water is increased, thus it stimulated the peristalsis movement, and when the peristaltic movement is increased, it can causes the evacuations of the semi-solid stool. Again, I repeat the mechanisms of the stimulant laxatives. When we take the stimulant laxative by oral, as it is non-digestible, so it can't digest it in the stomach, so it easily come into the colon, and in colon the stimulant laxative bind with the colonic mucosal layer, and when these drugs are bind with the colonic mucosal layer, it can causes irritations of the mucosal layer, and for that inflammations are occur in colonic mucosal layer. So when the inflammation is occurred in colonic mucosal layer, there is increase the prostaglandin and cyclic adenophosphin monophosphate level in the colon, and when these are increased, it inhibit the Na plus and K plus ATPase, and by this activity increase the secretions of water and electrolyte. By this activity, peristaltic movement also increase, and when the peristaltic movement increase, it can causes evacuations of the semi-fluid stool. So all are understood about the mechanisms of the stimulant laxatives. Now I discuss what are the adverse effect of the stimulant laxative. Mainly it can causes cramping and skin rashes. But when we use this stimulant laxative for a long time, it can also causes mucosal layer damage, colonic atony and fluid and electrolyte imbalance. This stimulant laxative also stimulated the uterine contraction, so it can be contraindicated in pregnancy because it can cause reflex stimulation of uterus. So these are all about the stimulant laxatives. I think you all are understood about the stimulant laxatives. But one thing I remembered about this stimulant laxative, that are the Sena act on within 8 to 24 hours, but bisocodiles act or work within 6 to 10 hours. Okay, I hope you all are understood about these two types of laxatives, that are the bulk laxatives and stimulant laxatives. And in other video I will describe about other two types of laxatives, that are the osmotic laxatives and stool softener. Okay, thank you for watching. Please subscribe my channel.